Simon Harris was Minister for Health, and he accepted that the overcrowding levels at UHL would be unsustainable and greater use had to be made of the Tier 2 hospitals, Nina, St John's in Limerick and Ennis, to avoid everybody going into what was already an overcrowded hospital.
Look, in the time available to me, let me acknowledge the Midwest has been failed for decades in terms of bed numbers. And I'm not here to apportion blame either, but we all know the story. Changes were made, beds were promised, beds never came.
Dr. Liam Woods of the HSE was before the committee twice, and he explained that yes, there was planning was going on for increased services to be provided in the Tier 2 hospitals. It is a catastrophe waiting to happen, and the clock is ticking.
So, Chair, if I take that, the answer is yes to your question, and there are specific proposals which we're considering as part of our approach to the coming months and the winter period from the UL group. So there are proposals to make more use of Nina and Ennis and support Duradoyle in that context.
I asked Dr. Ms. O'Connor that question when she was last before, and she didn't have an answer, but she said she'd provide it in writing. Specifically, when are we going to see increased procedures being carried out in the Tier 2 hospitals? Because we were told that would be the case.
In terms of a date, I'd have to look at it. I don't know the dates.
Can you provide that to me in writing,
work
perhaps?
on that.
Can you provide that to me in writing?
We can look at that, yeah.
Now, yesterday there were 65, now we're 3 months out from the peak of typical overcrowding in Limerick, and there were 65 people and trolleys in UHL. Today, there are only 53. There was no mention in the written response that I received from the HSE of what additional procedures would be carried out in Tier 2 hospitals to stop people having to go into an already overcrowded hospital. There wasn't one mention of Ennis, there wasn't one mention of Nina, there wasn't one mention of St John's. If we're going to funnel everybody who's sick in the Midwest into UHL, which is dealing with COVID cases, dealing with emergency cases, it is inevitable that COVID is going to spread in there. And we don't know how many, but there was a lot of media reports, a large number of people contracted COVID in our healthcare system, in our acute hospitals last winter. And of course, a large number contracted it in nursing homes. Now, we've learned a lot that should be avoidable. But what on earth is going to happen in the Midwest if are we going to funnel everybody into an overcrowded hospital, or are we going to use the Tier 2 hospitals so that people can get medical services in those hospitals and not have to go in to Limerick?
So I think in terms of the sites, we know that already in terms of, you mentioned Ennis, Nina and St John's, that they provide support to UL. As it stands every day, we're transferring about 17 patients to these sites. We also know that those units have medical assessment units, and they admit directly from those units where people don't have to come through UL to go there. In terms of other things that are going on, in terms of Ennis, we're looking at the capacity relating to, I suppose, supporting the new IPC guidance, and they're doing a lot of work around endoscopy and bowel screen, and that is going to continue. In terms of St John's, they're at about 80% of their planned activity already, and we are working in terms of how they can increase that, looking at diagnostics to support other cancer services and other services as part of our service continuity work. And then in Nina, similarly, we're working with the NTPF in terms of dedicated funding. They're already doing dedicated cataract activity, and that's going to continue. And we're also looking at other, other initiatives that they can do to support care within the main site. However, there is a lot of work going on with those sites in UL, so there's activity already there. We also have the arena in Limerick that is operating, and we know that there's about 30 patients there, and that centre...
Is that going to be continued through the winter, the arena in Limerick?
No, it won't. It'll end in November. However,
so as we head into the flu season, it'll end. Sorry, however, I cut you short. My apologies.
We have the new capacity coming on stream in Duradoyle then. Okay. So we have a 60-bed unit and another unit coming in, which will come on stream as the arena goes off.
Okay. Quick yes or no answer. Are there any plans to increase the capacity of the medical assessment units in Ennis, Nina and St John's?
I can't answer. I'd have to check that. But in terms of the hours that they open, so our priority within the medical assessment units is to have them open 7 days a week, and for usually a minimum of 8 to 8. And I know the ones in the Midwest historically haven't all been open those hours. So our first priority would be to look at that.
Okay.